Collet-Siccard syndrome is a rare but critical neurological condition affecting the lower cranial nerves, specifically cranial nerves 9 through 12. These nerves play an essential role in functions like swallowing, speech, shoulder movement, and tongue control. Understanding this syndrome is crucial for diagnosing related conditions early and providing the right care. The glossopharyngeal nerve, 9, governs taste on the posterior third of the tongue and helps control swallowing. The vagus nerve, X, is responsible for many key functions like regulating heart rate, digestion, and speech, while also contributing to the gag reflex and swallowing. The accessory nerve, 11, controls neck and shoulder movements, particularly through the trapezius and sternocleidomastoid muscles. Lastly, the hypoglossal nerve, 12, is responsible for tongue movements that are critical for speech and swallowing. The causes of Collet-Siccard syndrome can vary, but tumors around the jugular foramen, such as glomus jugulare or schwannomas, are among the most common. Traumas like skull-base fractures or post-surgical complications can also lead to this syndrome. Other causes include carotid artery dissection, aneurysms, and infections that may affect the base of the skull. Clinically, patients present with a combination of symptoms linked to the affected nerves. Dysphagia or difficulty swallowing is common due to the involvement of cranial nerves 9 and X. Dysarthria, or trouble with speech, arises from both vagus and hypoglossal nerve dysfunction. Hoarseness or voice changes are also frequent, stemming from vagus nerve damage affecting the vocal cords. In more advanced cases, patients may experience tongue weakness and atrophy, where the tongue deviates toward the affected side. Additionally, damage to the accessory nerve can cause shoulder weakness, leading to difficulty elevating the shoulder or rotating the neck. Diagnosis begins with a thorough neurological examination, specifically testing the functions of the lower cranial nerves. Imaging techniques like MRI or CT scans are essential to visualize the lesion causing nerve compression or damage. In cases where vascular issues are suspected, angiography may be required. Additionally, electrophysiological studies can be used to measure nerve damage more precisely. Treatment for Collet-Siccard syndrome largely depends on addressing the underlying cause. If tumors are involved, surgery may be necessary to remove them and relieve pressure on the nerves. For infectious or inflammatory causes, antibiotics or steroids may be used. Symptomatic treatment is also crucial. Speech therapy can help patients regain control over speech and swallowing, while physical therapy may be needed for shoulder strength and mobility. In severe cases of dysphagia, nutritional support via feeding tubes may be necessary. The prognosis of Collet-Siccard syndrome varies. When the underlying cause is treated early, recovery of nerve function is possible. However, delayed treatment or permanent nerve damage may result in long-term difficulties with speech, swallowing, and shoulder function. Understanding the early signs and clinical presentation of Collet-Siccard syndrome allows for timely intervention and better outcomes for patients.